Hello, I am Dr. Harry Erba, Professor of Medicine and Director of the Leukemia Program at Duke University in Durham, North Carolina. I would like to discuss with you the myeloMATCH Precision Medicine Initiative. myeloMATCH is a program that has been sponsored by the National Cancer Institute and involves hundreds of sites across Canada and the United States. What is different about myeloMATCH is that there is a collaborative effort among leukemia experts across Canada and the United States to develop novel therapeutic options for people with acute myeloid leukemia. The reason that we have developed the myeloMATCH Precision Medicine Initiative is that we have learned over the last 10 years or more that AML, or acute myeloid leukemia, is not exactly the same disease in every patient. This disease, AML, can be triggered and caused by various different types of genetic changes that occur in the bone marrow cells leading to this cancer. During this time, we have gathered great insight into how some of these genetic changes lead to leukemia, leading to the development of drugs that can specifically target the specific genetic change in a specific subtype of acute myeloid leukemia. Some of these genes go by the names of FLT3, IDH1, IDH2, NPM1, KMT2A, and there are many others. Our challenge is that when a patient presents with acute myeloid leukemia, we need to understand the biology of the disease very quickly in order to institute the right type of treatment for that person and consider a clinical trial of a novel agent. And so rapid identification of these genetic changes is critical. Typically, at most laboratories, the turnaround time for these assays can be 7 to 14 days, if not longer. The myeloMATCH Precision Medicine Initiative allows sites, their investigative sites, the doctors, and the patients to receive detailed information about the mutational landscape of that patient's specific personal leukemia within 72 hours, allowing the doctor then to make a decision about the best treatment for that specific subtype of AML. We are trying to improve the outcomes of people with acute myeloid leukemia by developing novel therapies that are specific for each of these different genetic subsets. And so the myeloMATCH Precision Medicine Initiative includes multiple different studies that will target various mutations that are seen. And these clinical trials will focus on the different parts of the patient's journey through therapy, the initial therapy that we call induction, the follow-up treatment after induction that we call consolidation, transplant, which is a critical part of treatment in AML, and even maintenance to prevent the disease from recurring. And so the structure of the myeloMATCH Precision Medicine Initiative is to develop clinical trials at each stage along the patient's journey that will include novel therapeutic options for the specific genetic change that the patient has. Now, as we dive into the biology of AML, what we are seeing is that there are smaller and smaller subsets of patients with a specific genetic landscape. And so in order to develop any information about the impact and efficacy and safety of a specific combination, we need numbers. We need large numbers of patients. And this was really the impetus for the National Cancer Institute to partner with leukemia specialists across North America to develop this precision medicine initiative, so that in each of these very small subsets of the disease, we can do our best to develop the most optimal therapy for each patient based on the genetic makeup of their acute myeloid leukemia. We just launched myeloMATCH a year ago. We are in our beginning stages, but we are very excited about the future as new drugs become available to us for AML. The myeloMATCH Precision Medicine Initiative gives us the platform to test which of these drugs and combinations will give the most optimal results for people with acute myeloid leukemia. Thank you.